The American Heart Association has released new recommendations to help protect people from one of the leading causes of death in Canada.
Well, we know in Canada there's over 108,000 new strokes a year, right? We have 108,000. We have almost a million people living with having had some effects from stroke.
Stroke is a sudden loss of brain function caused by a blocked or ruptured blood vessel. And for Dr. Lindsay, the lead engagement and stroke strategist with the Heart and Stroke Foundation of Canada, the first step in prevention is to know what your risks are.
Was it high blood pressure? Did you have problems in pregnancy? Did your mother have problems in pregnancy? Did your mother or father or grandparents have stroke at an early age, like early onset, before the age of 60? Those are all risks. And then think about, okay, so what can you do? Exercise is probably one of the most effective, cheapest ways to reduce your risk of stroke.
Now, the American Heart Association is painting a fuller picture about risk factors. In newly published guidelines, the organization takes social determinants of health into consideration, or in other words, non-medical factors that can influence health outcomes.
All of our guidelines, the Canadian guidelines as well as the American, are looking at food security, how to adjust. Air quality is another really big one. Another area is safe spaces. We tell everyone to go out for a walk, get their exercise. But we want to make sure that they can do that in a space that's safe.
The AHA guidelines also recommend doctors screen for conditions that could increase a woman's risk for stroke.
Early menopause, late menopause, early onset menarche, late onset menarche, multiple miscarriages. These are all major risk factors for heart conditions and stroke. The number of women versus men who have a stroke aren't that different, but more women die of stroke. 30% more women die of stroke than men. Women are more affected. It hits them harder.
Dr. Lindsay says there's a new risk screening tool for women in the works over at the Heart and Stroke Foundation, and that'll be available in the spring.
It's not a conversation for 70 and 80-year-olds anymore. It's a conversation for everybody. And we need to start having that conversation and being more mindful about it.
To find out more information, head on over to heartandstroke.ca. Rhianne Campbell, City News.